We have an update on the spread of the deadly coronavirus.
A deadly and contagious virus.
Record cases, deaths, and hospital levels.
It's going to get worse.
The great shutdown of 2020 is underway.
It became an all-consuming endeavor where, there was no sacrifice too big or too small that we were willing to make personally in order to make this happen. I'm the Director of Immunology within Moderna's Infectious Disease Group. I led the research and development of Moderna's mRNA-1273 vaccine, which we developed to address the SARS-CoV-2 pandemic. Late in December, early in January, we got word that there was this virus that was circulating. Once the pandemic was declared, the mindset shifted from a research activity, here's what we can do with our mRNA platform. It turned into there's a global need. It was all hands on deck. It was, we know we need to move fast. We know we need to move fast with good quality. We know we need to do all the work that will make people comfortable taking this vaccine with a very small number of people and trying to do it more rapidly than anybody had ever done it before. I applied the training, both the undergraduate and graduate training that I received at UCF in a novel way towards vaccine development.
I have very high expectations of my students, but generally, if they get through with the PhD program in my lab, they really have been prepared. I tell them all the time that we're constantly trying to change the world, and we have. And you can see from the students I've gone out, not only Darin, but many others have been very, very successful because I think of that mindset that they get when they leave here.
Well, we're getting Moderna's phase 3 interim results, 94.5% efficacy.
Well, I'm kind of speechless to a degree. 94.5%.
94.5% effective.
We expected it to be effective, but to see that number and to have it confirmed, it meant all the effort was worth it. It meant that the pandemic would ultimately end. Honestly, the best reward that I've had is the moment I saw the pictures of my parents with the vaccines in their arms, and I broke down. And that was, I talk about global health and affecting global health. There's nothing more immediate than having your own parents at risk. And that was a pretty good moment. The time here at UCF has really been one that has set me up to where I am now. And that's not only because of the education, it's because of the friendships, the experiences, the time, it all goes into that. And I had to pull from experience in the past in developing new approaches to tackle this horrible pandemic. There's something that has to be done, or else people are going to continue to die. Businesses are going to continue to be shut. Who would we be as scientists, as researchers, as global citizens to not give whatever had to be given in order to make it happen?